Hello, and welcome to the StemCell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. This is a weekly podcast, so please stay tuned for future podcasts. We are here with Dr. Sara Figueredo, and we have a very interesting topic today, which is arthritis. Doctor, how are you?
Well, thank you so much, Luis. How are you doing? Always a pleasure to be here.
I'm doing great. So today about this topic about arthritis, I would like to know, doctor, what types of arthritis can we treat?
Yes, that's a very good question because there's more than one type of arthritis, Luis. There are the one that is very, very common and probably the one that we treat the most is degenerative osteoarthritis, which is basically where the cartilage has worn down and from the normal process of wear and tear and aging and sports injuries, which is such a common one, um, and that type of arthritis. And then there is an autoimmune type of arthritis, which is called rheumatoid arthritis, and we treat both very successfully with stem cells at our clinic. And it's probably one of the treatments that we do most is for arthritis and sports injuries and physical injuries that cause pain. Pain is so ubiquitous in our society, and that's the number one reason that patients go see their doctors is to relieve pain. So it is one of the most common treatments that we do at the Stem Cell Healing Institute.
And I believe if a patient suffers from arthritis, what will be the whole process of stem cells for the stem cell treatment?
Yes, that we start with a lot of the basics. So we look at their lifestyle and any inflammation. So we address inflammatory factors, inflammation in their diet, an inflammatory diet. So we want to decrease first and foremost inflammation with good dietary choices, certain key supplements, and we start there. And then we continue on with once they get to the clinic for treatment, we do a total detox, which again helps with inflammation and a detoxification of the liver and the body to prepare the body for the stem cell treatment. And that's a nutritional IV in the form of a nutritional IV that's concentrated with antioxidants and key minerals and vitamins. And then we follow that up also with a growth hormone therapy, age-appropriate growth hormone therapy. And again, that's preparing the body and the stem cells, if we're doing an autologous treatment, to receive the stem cells in the best possible environment. And we also do oxygen therapy, and that could be in the form of hyperbaric oxygen or exercise with oxygen, 20 minutes on a bike. We like to do the EWOT, as we call it, exercise with oxygen therapy, more often as opposed to the hyperbaric oxygen therapy because of the length of time and a lot of factors that are involved with HBOT versus EWOT. And so we do the oxygen therapy, which again is sort of fortifying the body and the stem cells and rejuvenating them. And we have our proprietary stem cell enhancement formula, which is a combination of key herbs and minerals, again to help and to help the stem cells and the body to receive the stem cells. So that's sort of our pre and post treatment protocol. We start with much of this, and we continue with much of it post treatment. And in the case of these types of injuries, sports injuries, and as well as osteodegenerative arthritis, we most likely would go with bone marrow stem cells, autologous bone marrow stem cells from the from the patient's own body. It's a very non-invasive procedure, and then there's an abundance of stem cells in the bone marrow. We pre-treat the body to get hundreds of millions of stem cells. And however, if we were treating rheumatoid arthritis, we would opt for most likely a combination of bone marrow and endometrial stem cells because um, uh, autoimmune diseases such as rheumatoid arthritis, multiple sclerosis, diabetes type 1, so on and so forth, that type of autoimmune condition responds very well to endometrial stem cells. And so we do a combination of both to get the best results.
And in this case, for arthritis patients, do we apply the stem cells locally or is it by IV?
That's a very good question, Louise. Yes, in the case of joints, when when we're treating joints or connective tissues like ligaments, meniscus, tendons, and then of course the cartilage within a joint, it is very much localized. And the reason for that is because these structures in our body are so um, void of vascular of blood flow, and so the vascularization of these structures in our body is so low, so that we have to for the best results we have to localize the injections right into the joint, right into the tendons, right into the ligaments, because the blood supply to these structures is very low. And so putting the stem cells IV and deploying the stem cells in any other manner just would not be as effective as applying them locally. So yes, absolutely, we do it locally. That's a very good question. Thank you for that.
So, doctor, is this treatment right for any age?
We have had absolutely, because we have younger patients who have injuries or they play sports or whatever sort of physical injury that they are accidents, and so we treat younger patients absolutely, and then of course we treat older patients who have pain just again from the normal course of aging and normal wear and tear, and patients into their 80s and 90s, literally, that we've treated. So yes, it is a very wide range of age of the patients that we treat. Absolutely. And we've had a lot of questions about whether this is a painful procedure, and everything is done under local anesthesia as needed. We prefer not to use anesthesia if we don't have to. Um, I have had these treatments myself without anesthesia, and I have been able to get away without anesthesia and being very, very comfortable. So it depends on the patient, and we individualize each treatment. So and we want to ensure that each patient is very, very comfortable. So it's that's how we proceed with the treatment.
So it's not painful at all, and also you can enjoy your trip in Guatemala. But doctor, tell us, what if a patient wants to get a hold of you? What will be the best way to contact you?
Absolutely. They can reach us by email at info@stemcellhealinginstitute.com. They can also reach us by phone. We have a US number. It's 209-690-7836, 209-690-7836. We also welcome WhatsApp messages at +502 4220 7297. Again, that's +502 4220 7297. And we always love to see you visit us on Facebook, Instagram, as well as YouTube, where we post a lot of our videos and podcasts as well. Oh,
So
and
if
Anchor as well, right?
it's they are on Anchor and also on YouTube, yes, and
That's
also
right.
Spotify.
And Spotify.
Okay, doctor, if a patient would like to come to Guatemala, we can provide accommodations for him or her, right?
That's right. So, in with the treatment, we include accommodations at a very comfortable two-bedroom Airbnb type of facility with all of the amenities of your home, so you can cook and everything there. And we also supply a chauffeur or a driver to take you to and from the airport, bring you to and from appointments, and so we make it very, very feasible and simple for you to travel and come for treatment. And we make sure that you're well taken care of. And we have a lot of patients that do. Guatemala is a destination spot for a lot of medical tourism. So, and we have the beautiful um, Mayan ruins, as well as the active volcanoes, as well as coffee farms. And so a lot of our patients make it a touristic destination trip as well as with the medical tourism aspect of it. And so they kill a couple of birds with one stone.
Sure, and we can also set up some trips for you to see Guatemala. And we have great connections with local tour operators. So think about that.
That's right.
You're coming for a
That's
treatment,
right.
you come for a treatment, and you also can travel around. Doctor,
That's
is there
right.
anything else you want to add to this podcast?
No, I think we've covered a lot of ground, Luis. Thank you so much for having me. And it's nice that it's a Friday. So I wish you a wonderful weekend and to our listeners as well.
Okay, Doctor, you have a nice weekend as well. You take care.
Thank you
See
so
you
much.
next week.
Bye. Yes.